And I'm the director of the Social Protection Department of the International Labour Organization, ILO, based in Geneva, but connecting with you today from the ILO office in New Delhi, India. Now, the objective of today's webinar is to present a study commissioned by the Social Protection Department on the experiences of setting up global funds across the health, climate, and agricultural sectors, and the lessons that can be gleaned from these very diverse experiences to really give us guidance for further thinking about the implementation of a potential global fund for social protection. Now, what do these experiences tell us about the governance issues that need to be navigated in the design and institutionalization of a global fund for social protection? How can in-country engagement be pursued? And what does meaningful country ownership look like? How can the quality of investment in social protection be assured by really aligning it with human rights and international labor standards? These are some of the questions that the paper addresses. Now, before introducing the authors of the paper to you and asking them to present their findings, allow me to give you a very rapid recap of the background to today's webinar. Now, the facts, I think, are very clear. More than 53% of the global population, that is 4.1 billion people, especially many of those being in low and middle income countries, have no access to social protection. This stark fact, we know, is underpinned by serious underinvestment in social protection. Itself, the outcome of serious structural inequalities in the global development and financial architecture. Now, this situation, we know, is only getting worse in the current context when about 15% of low-income countries are already in debt distress and an additional 45% are at high risk of debt distress, according to the IMF. In the case of middle-income countries too, we know that servicing the public debt is rising at a higher rate than the public resources these countries are able to allocate to social protection, as was recently reported by the Economic Commission for Latin America and the Caribbean. So the idea of a dedicated global fund for social protection, where did this come from? This entered the global policy arena with the publication in 2012 of a paper by the then UN Special Rapporteur on Extreme Poverty and Human Rights, Magdalena Sepulveda, and the UN Special Rapporteur on the Right to Food at that time, Olivier de Schutter. A global fund for social protection, these two UN rapporteurs argued, could address some of the constraints that prevented highly resource-constrained countries these highly resource-constrained countries from developing a social protection system. A related issue is that these countries, they argued, are unable to really withstand the disruptive effect of major shocks, be it climate-related, a major conflict, or an economic crisis. Keeping in mind that in 2012, of course, the global financial crisis was on everyone's mind. Now, as such a global fund for social protection would function as a stabilization mechanism, Sepulveda and de Schutter called this a reinsurance facility, and it would increase the capacity of countries to really withstand the effects of such shocks. The potential of it was really important if countries wanted to develop, which was being advocated, to have rights-based social protection systems. If they were to have rights-based social protection systems with entitlements that were really anchored in legislation and enforceable in ways that guarantee those rights in the long term, then they needed to have this reinsurance facility to be able to hold that promise and to deliver those legally anchored benefits. Now, these arguments that were made in 2012, of course, regained and saw renewed traction during the COVID-19 crisis, which once again revealed very stark gaps in social protection systems around the world and highlighted the urgent need to build universal systems so that countries were better able to withstand not only the day-to-day life cycle risks that people face, but also future shocks, be they climate-related, a pandemic, or otherwise. So, not surprising, at the 2021 International Labour Conference, which had a dedicated discussion, a recurrent discussion on social protection, ILO constituents, this includes governments, workers, and employers' organizations, asked the ILO, and here I'm quoting, to explore options for mobilizing international financing for social protection to complement the individual efforts of countries with limited domestic fiscal capacities based on international solidarity, and initiate and engage in discussions on concrete proposals for a new international financing mechanism, such as a global social protection fund, which could then complement the domestic resource mobilization efforts of countries. Now, an important response, I think, to this call has been ILO's contribution alongside other UN agencies and development partners in taking forward an initiative of the UN Secretary General's, the Global Accelerator on Jobs and Social Protection for Just Transitions, which includes both an integrated employment and social protection policy push to support countries in creating jobs, decent jobs, at scale in the green, care, and digital sectors, and also extending social protection to more than half of the global population that is currently excluded, backed by what the accelerator brings, also an integrated financing strategy, which has a foot in domestic resource mobilization, but also bringing in that global solidarity mechanism, financing, international financing to support countries. This initiative is now being implemented in the first set of Pathfinder countries. At the same time, we also thought it was really important to commission a detailed and robust, empirically based paper that will be presented today to really identify key lessons from the very diverse experiences of global health, agriculture, and climate funds that can then guide the possible implementation both of a global fund for social protection, but also feed into the Global Accelerator initiative, especially its governance mechanisms. So this is what brings us today to the discussion that we're going to have, the presentation followed by the discussion on some of the lessons to be learned from other global funds, so that we don't reinvent the wheel and we really build on the lessons from other experiences. So without further ado, let me introduce you to our two lead authors of the paper, as well as the five distinguished discussants who are here. Now, in the interest of time, I will keep the introductions brief and ask you to please read the full bios of the participants and speakers in the events page. Our two lead authors are Nicola Yeates and Chris Holden. Nicola is Professor of Social Policy at the Open University in the UK, and Chris is Professor of International Social Policy at the University of York, also in the UK. We also have with us today Marcus Kaltenborn, Professor of Public Law at the Faculty of Law and co-director of the Institute of Development Research and Development Policy in Ruhr University in Bochum, Germany. Gita Sen, Honorary Senior Advisor and Distinguished Professor, Ramalan Gaswani Center of Equity and Social Determinants of Health in the Public Health Foundation of India, based in Bangalore, India. Olivia de Scutter, whose name you already heard, who is now UN Special Rapporteur on Extreme Poverty and Human Rights, as well as being Professor of International Human Rights Law at European Union Law and Legal Theory at the University of Louvain in Louvain-la-Neuve in Belgium, as well as at the College of Europe and at Sciences Po in Paris. We also have Pierre Vincenzini, who is Senior Advisor at the International Organization of Employers, IOE, and Alison Tate, Director of Economic and Social Policy at the International Trade Union Confederation, ITUC. I would like to please ask you, while you're listening in to the presentation of the paper, to already start typing in your questions in the Q&A box, questions that you want to address to Nicola and Chris. And then when we get into the discussants' remarks, please continue if you have questions, and do specify who the question is addressed to, unless, of course, you're addressing it to all of the speakers, but otherwise, please specify the speaker so that we can have a more structured discussion. So let me now turn to Nicola and Chris. The floor is yours, and you have 20 minutes for your presentation. Over to you.
Okay, thank you. Thank you, Shara. Thank you for that comprehensive introduction and context setting for the idea of the Global Social Protection Fund. I'm Nicola Yeates and co-presenting here today with Chris Holden. We have other members of our research team and co-authors here at the webinar, Rusa Lambin, Carolyn Snell, Nabila Idris, and Sophie McKinder. And at this stage, I'd really like to thank the ILO Social Protection Department and socialprotection.org for hosting this webinar and supporting the launch of this report. And I'm really looking forward to the discussion that I feel we're going to have about these important issues. So let me just say very briefly a little bit about the drivers of this research. As Shara said earlier, over half of the world's population are excluded from any form of social protection, especially those living in low and middle income countries. And of course, as she also mentioned, this is at least partly attributable to the structural gaps in the global financial and development architectures that have failed spectacularly to support the development of universal social protection systems and floors. So in undertaking this research, we were asked to focus on the governance structures. Governance isn't just part of the kind of operational side of any program or entity, it's absolutely core to the ways in which an international financing mechanism for social protection or any other aspect is actually set up and the conditions under which it operates. So it's absolutely overarching and maybe underpinning as well. So our research focuses on the governance structures, and in this we focused on the experiences of the setting up of other global funds in other sectors and their practices, and with a view to identifying the lessons that we could take forward in deliberations about implementation of a putative GFSB and indeed an accelerator. So there is clear evidence for looking at these particular forms of international financing, i.e. the global funds. So let me just share this slide with you. This shows that global funds have commanded a much greater an increasing proportion of development aid, in particular country programmable aid, over the period from 2007 to 2020. In fact, it's tripled. Most of this is attributable to global funds in the health sector. So the blue line, we have the Global Fund on HIV, AIDS, TB and malaria, and the grey line is Gavi, with a much smaller proportion being accounted for by the Agricultural Fund and the Climate Funds, which were much more recently set up. So the focus of our research was squarely on these 7 funds. I'm not going to read them out, but just to say that we selected them very carefully for their diversity in order to gain the broadest possible perspective. And just a note on the terminology before I proceed any further, we use the term global fund in a generic sense. So it's not to think that when we mention global fund, we're always talking about the GFATM. We should also note that there are 2 sorts of ways of kind of financing these kind of entities. One is a fund, the second is a financing facility. Technically, we have both represented, although for the purpose of today, we'll be referring to them as funds. There's more detail in the report. Now, in terms of our dimensions of governance, this is the analytical framework that we use. We had 5 key dimensions of governance. All are essential, all are critical when we want to think about governance. So these determine the conditions under which a fund would be set up, who would be included, who would have a voice, where finance is sourced from, and the power relationships between all of those stakeholders in the fund, which is necessary in order to inculcate and assure continued ownership of the fund over time, while all the while being mindful of the need for high quality investment aligned with international human rights and labour standards, and also, of course, not forgetting the need for a strong focus on data, results, learning, and innovation. It's really important that a fund is very flexible, it is mindful, insofar as it can be mindful. It's mindful, aware of the wider circumstances and the changing circumstances in which it is operating. So those are the 5 dimensions. I'm now going to hand over to Chris, who will be presenting some of the key findings. Thank you.
Okay, thanks, Nicola. So I'm going to speak to the headline findings on each of those 5 dimensions of governance. So starting first with the first dimension, and looking at the big picture, in terms of the climate funds, all of the climate funds that we looked at have their roots in the UN Convention and UN Framework Convention on Climate Change. And that's really important in facilitating synergies and high-level political support. The health funds are really quite different because the Global Fund for AIDS, TB and Malaria, which I'll just call the Global Fund for now, the Global Fund and Gavi were specifically set up as independent global public-private partnerships. So even though the WHO has a seat on the board of both of those and is involved in those, arguably that setting up of those funds as independent entities undermines the capacity of the WHO as the leading international organization in the health field. The other issue is that the proliferation of different funds in health can lead to fragmentation. The World Bank plays a key role for many of the funds that we looked at, and particularly for the Global Financing Facility, which is exactly that, a financing facility of the World Bank. So one really key issue in terms of governance is about the representation of developing countries on the governing boards of the funds. The Adaptation Fund is unusual in affording developing countries a clear majority on its board. The other funds usually have developing countries on their board, but they're not usually a majority. Informal practices we found are also important in affecting kind of what really happens in practice, if you like. So informal donor state caucuses prior to board meetings, for example, can be influential, and developing countries don't necessarily have those. And then lastly, scrutiny from civil society organizations and independent experts is very important, both on the boards and externally. So moving then to that second dimension of governance and splitting it into 2 and looking first of all at the participation of and engagement with national stakeholders. We found that the direct access model used by the Adaptation Fund and other funds is important in facilitating both stakeholder participation and country ownership. So what this means is that national entities can apply for funds directly to the fund without having to go through a UN organization as a mediator. For CSOs, they need a lot of technical support for things like bid development, as well as financed participating meetings and so forth. So some CSOs are better equipped than others, and so where that kind of support isn't available for CSOs, then the risk is that CSOs that represent more marginalized communities cannot participate effectively. And then moving on to the second aspect of that second dimension, which is country ownership and coordination with national authorities and donors. As I've said, the direct access model is key to bolstering country ownership, but it does raise issues of capacity and accountability, so it needs to go hand in hand with capacity building. The proliferation of health funds creates the potential for duplication or conflicting goals, as I've already said, but this is mitigated to some extent by coordinating mechanisms such as the global funds, country coordinating mechanisms. And then lastly, in terms of country ownership, I've already mentioned low-income country representation on boards, but conditionality is also very important for country ownership. In general, where funds have more conditionality, that tends to undermine a sense of country ownership by low-income countries. So moving on to the third dimension of governance, which is about resource mobilization, and again, splitting it into two. So looking first at the crowding in of global funding sources. As we've said, the Global Fund and Gavi were set up as separate global public-private partnerships, and the purpose of that was specifically to crowd in funding and in-kind donations from the private sector, such as pharma companies, and foundations such as Gates. And they've been very successful in doing that, but that has led to a situation where these private sector entities are given a formal role in the governance structures of the funds themselves, which arguably undermines accountability. There's also an argument that it tends to undermine the normative human rights-based framework of the WHO, because these funds are not situated within the WHO, and private actors play a key role on them. In agriculture, IFED has been much more cautious about private sector involvement. So it's interesting that IFED sees the potential for private sector involvement to detract from its reputation, so it's very careful about how it manages that. The climate funds do often use co-financing with the private sector. That tends to suit mitigation projects much better than adaptation projects. And then just a few points to finish on with this particular aspect. Innovative forms of finance are often suggested as a kind of solution to the funding gap for social protection, but we would urge caution on that. The extent of new money that can come from these forms of finance is often overstated. Some actors and some of our respondents advocated international forms of taxation, so a financial transaction tax, for example, or the scaling up at the global level of airline taxes and carbon taxes. And then lastly, there is a good case for making climate adaptation finance available for social protection. Then to move on then to the second aspect of this dimension of governance concerned with resource mobilization, which is the development of sustainable national systems and the crowding in of domestic funds. And the really important point here is that a key aspect of the proposed Global Fund for Social Protection is intended to ensure sustainable domestic funding for national social protection systems. So the idea is that where a global fund supported the building of social protection systems in low-income countries, that would be short to medium term, but would be withdrawn over the longer term, and that gap would be filled in by domestic sources of fundings themselves. So that makes it different to some other funds that we looked at. So the climate funds, for example, use co-financing with recipient governments, but the key difference with a Global Fund for Social Protection is that the climate funds are premised upon the principle of common but differentiated responsibilities between developed and developing countries. So that means that transfer of funds from high to low income countries may be something that continues over time. In health, the Global Fund is premised on responding to need, not domestic financing capacity. But there is a debate about whether it facilitates the development of sustainable country-level health systems or not. But having said that, the Global Fund does aim at graduation away from support as countries move up the income ladder. Both the Global Fund and the Global Financing Facility offer debt swap agreements with national governments, which is worth further investigation. And lastly, domestic resources can be enhanced by the taxing of public bads, so things like tobacco, sugary foods, carbon at the national level, and so forth. And then to move on to fourth dimension of governance, which is about the quality of investment and the alignment with human rights and international labour standards. The human rights emphasis in all of the funds that we looked at tends to be on gender and Indigenous people, with some mixed results. Interestingly, for the health funds, the broader human rights that affect health, including those related to income security, the right to health regardless of income, and labour standards, so the social dimensions of health, those tend to have received far less attention, which perhaps relates back to the point about the normative role of the WHO and whether this might be undermined by freestanding global public-private partnerships. And then lastly on this, in agriculture, IFAD sets a positive example by adhering to the 10 principles of the UN Global Compact and requiring all investments and private sector partners to join the compact and to adhere to those principles. And then for the fifth dimension of governance, which is the focus on data and so forth, of course, all the funds that we looked at have monitoring and evaluation frameworks. The health funds in particular have clear metrics-based frameworks, but have successfully supplemented that with community-based engagement and evaluation. So then to try to sum up some of the kind of headline conclusions and lessons from the evidence from these funds in these other sectors. Clearly, the financing gap for social protection needs to be closed, and a global fund for social protection could be a key mechanism for that. But there are risks and challenges. The experiences of the global health funds suggest that it's necessary to have strong high-level support, high-level political support from the start, and large donors willing to commit funds and sustain them over time. So one risk is that if that commitment isn't there, the fund could be created, but not really take off. An additional global fund could also fragment funding to low-income countries further or create parallel structures rather than contribute to the building of sustainable national social protection systems, which is the core goal. There are clear accountability issues relating to the involvement of the private sector. So the terms of engagement with private sector funders and partners needs to be clear from the start. Embedding robust environmental, social and governance norms and standards into a fund's practices and investment strategy is essential. And lastly, country ownership and stakeholder engagement are crucial to the success of the fund and its goals, especially since sustained domestic funding will be needed in the long term. So just to finish then with some selected recommendations, should a global fund for social protection be created? We recommend that it should be clearly anchored in human rights instruments and international labour standards. Social partners and civil society organisations should be full and equal members of inclusive deliberative processes around the setting up of a fund and the form that it should take. Seeking funding from the private sector and philanthropic foundations in no way implies that they should have a role in the governance structure of a global fund. Innovative forms of financing and partnerships with private actors, we recommend, should be premised on adherence to the principles of the UN Global Compact, following the example set by IFAD. And low-income countries should have a key role in the governance, in the fund's governance structures, and on at least an equal basis with high and middle-income countries. Open and widely accessible board meetings and robust monitoring and evaluation systems would further enhance transparency and accountability, and country ownership can be further enhanced by minimizing the use of explicit or implicit conditionality. And then penultimately, a further consideration should be given to the way that recipient countries would access a global fund. In this significant way, it should be given to the positive experiences and preferences of countries of the global south through a direct access model of allocating finance. And then finally, notwithstanding any of the above recommendations, global funds should operate on the understanding that recipient low-income country governments are committed to progressively building their own social protection systems and mobilizing necessary resources for these over time. So let me just, okay, so I don't think I'm sharing my screen anymore, so I can hand back to you, Shara.
Yeah, thank you very much. You still are sharing the screen,
okay.
Or maybe it's going to take some time. Yeah, now it's okay. Thanks very much, Chris, both to you and to Nicola. Thank you very much for a very crisp and informative presentation. We have a few questions, and I know we are always having to watch the time, especially since we do have our discussants, and I do want to make sure that we give time to them for their reflections. But I just want to pick up a couple of questions that have come up, and I leave it for you, Chris and Nicola, to decide amongst yourselves how you want to take it up. I saw one question about this whole issue about fragmentation, the risk of further fragmentation, especially if there is no new money being put up. This is kind of speaks to what I think some of us have seen in this current moment of difficulties in seeing new money on the table. So say a little bit more about this risk of fragmentation. And also there was, this is a question from Karen Gold from the Brookings Institute, if I'm not mistaken. And also there was the question from Shay, from ISA, who asked if you could say a little bit more about what you mean about this innovative financing, being a bit overstated. What exactly are you looking at? What sources of funding were you looking at? And can you elaborate what you mean by it being a bit overstated? So maybe I will leave those two, but you can also see other questions. But for now, back to you, Nicola and Chris, to answer the few questions that we have. Thank you.
Okay, thank you. Thank you for those questions. I think I'll start with addressing Karen's question about, she asked whether we have a recommendation about a standalone fund versus embedding it in another institution. We are agnostic on that. The one thing that we would say, and indeed it did say and recommend, is that a really important factor here is political legitimacy and acceptability of the fund. Absolutely crucial is the ownership, issues of ownership of the fund. So that should be the driving force of any decision as to whether this should be a standalone entity or, kind of embedded in, say, a UN institution or in the World Bank or indeed another institution beside. And I think we made that in recommendation number 16, which is the very last but not least recommendation. So I direct your attention to that, Karen. Chris, do you have anything more to add to that?
Not on that particular point, but I'm happy to come back on the questions that Shara asked.
Okay.
Yeah, if you want to just say something about fragmentation, either of you.
Okay.
You want to take that, should I?
Well, all I was going to say that, I mean, the risks are of no new money are that, you know, half of the world's population continues to not enjoy the kind of level of social protection that most of us here probably enjoy. I'm not quite sure what you're thinking of beyond that, to be perfectly honest. Chris, do you have any thoughts?
Yeah, on fragmentation, I think it's a fairly well-known problem in development funding that where we have a proliferation of different funds, that you know they can be channeling funds for programs in the same countries, but sometimes working to different goals, or sometimes actually duplicating and working to the same goal, but in different ways. So where we have these kind of freestanding entities, we have money coming through various channels that is not really being well coordinated. One of our findings was that that's less the case for the climate funds, because they all fall under the UN Framework Convention on Climate Change, which has its kind of annual kind of governance mechanism through the Conference of the Parties, that those funds tend to be much better at kind of working together and or having a sort of effective division of labour rather than kind of duplicating each other. I could also say something about the issue of innovative finance. Innovative finance is this kind of label that tends to get applied to a whole range of different ways of trying to raise money or pull development funding forward. Which usually they will involve the private sector in one form or another. So one kind of example of that would be where bonds or in practice kind of contracts are made whereby a private sector entity will provide the funding for a program up front, but effectively what governments do is kind of guarantee that future funding streams from their overseas development budgets will then go kind of to pay back the private entity. So it doesn't really produce new money, but what it does do, that particular example does do, is kind of pull overseas development aid kind of forward so that it can be made use of more quickly. So it doesn't mean that those things are bad, but you know, we would sound a note of caution, I think, that you know, to think that everything can be solved through these innovative forms of finance is really to miss the point. You know, there either is new money or there's not, and the money needs to come from somewhere. And so ultimately, you know, that does mean that we need to think about, you know, what the real source of the funding is, which is why some of our respondents had interesting things to say about international forms of taxation, which don't yet exist. The last thing that I would say on that, in terms of no new money, is that, you know, if there isn't new money forthcoming, in just to go back to the question about fragmentation, if there isn't new money forthcoming, but we still have a kind of fragmented kind of financing structure, then the problem there is that we just pull money, the overseas development aid flows are just pulled from one activity to another activity, but we're not really increasing the flow of finance available. So I think I'll leave it there.
Thank you very much. I'm conscious of time. There are a lot of really interesting questions in the Q&A box that I would really recommend that maybe Nicola and Chris, you try to answer some of those questions. I'll also try and draw on some of them in framing the questions that I want to address to our discussants so that we don't lose some of those really, really good points that have come up. So let me just now, thank you again, both Nicola and Chris, and hopefully we'll be able to hear a little bit more from you later. But let me now turn to our discussants to hear their reflections and thoughts. I'm going to start with Marcus, and Marcus, you've been writing, quite extensively about the kind of governance issues that Nicola and Chris have been talking about. And in particular, you've been raising kind of issues around how to comply with this principle of country ownership that they also highlight in allocation of funds, and to have a governance structure that's really oriented towards equal decision-making power of countries of the global south. Also, this is, I have to say, a key principle in ILO Recommendation 202 on social protection floors, this whole principle of real country ownership. So what lessons can we learn from the global fund experiences that we've just heard about very briefly from Nicola and Chris, but also that are analyzed in more detail in the paper that I'm sure you've seen? What do you see as kind of some bright spots? And what are some of the major risks in this regard? I'm afraid you only have 8 minutes to answer this question, but over to you, Marcus.
Okay, thank you, Shara. First of all, I would like to thank Nicola, Chris, and the other authors of the study very much for presenting such a clear analysis of the experiences of other global funds so far. This is extremely helpful for the further development of the discussion on global social protection. And thank you, Shara, that I get the opportunity to say something on governance aspects. The discussion on the Global Fund for Social Protection has been very much advanced in the recent months by the efforts to put the Global Accelerator Initiative into practice. The progress achieved so far is a major step forward, but it is certainly only an interim step on the long road to universal social protection. It is no secret that many actors, especially from civil society, advocate for a much more ambitious financing mechanism. Whether this mechanism is then called a global fund or something else is not of great importance. What is important is that the mechanism must be adequately funded, that it can operate effectively, and that it is designed in a fair and equitable manner. We can only hope that the general international framework or situation will soon improve again. Then perhaps there's also a greater chance to actually improve the social protection situation of people worldwide through a more ambitious global solidarity initiative. If we look at the effective coverage figures, we know how urgently this is needed. Now I would like to share just one slide with you all. I hope that you can see it. But no matter how extensive international support may be and what institutional framework it may take, some basic governance principles should be observed in any case: country ownership, inclusive partnership, and accountability. These principles are legal principles stemming from international development law and international human rights law. Those actors who are working on a governance structure for the Global Accelerator or who are thinking about a structure for a future global fund should comply with them, particularly because this would be an important requirement for the new global institution to gain broad acceptance and to work successfully. These three principles are addressed several times also in the study. The first one is country ownership. The authors of the study were absolutely right when they made clear that both the eligibility criteria and the way how access to funding is provided are crucial for the implementation of this principle. Country ownership means that funding should be based on country needs and priorities. Mechanisms that follow the direct access model contribute more to national ownership than those that additionally involve an intermediary. However, the authors also clarify that all global funds which have been compared in the study work by financing specific time-limited projects, often on a performance or results-based basis. And it is pointed out that for these funds, stakeholders other than governments are, at least in principle, also eligible recipients. But when it comes to international social protection, we are dealing with a different situation. Unlike in the health or climate sector, here it is always necessary to provide financial support for entire systems that are organized and supervised by the state and that are long-term in nature, because otherwise a rights-based life cycle approach to social protection cannot be realized. So what is the consequence of this? Country ownership in the governance structure of a global fund for social protection means that only the governments of the recipient countries should decide which social protection instruments they want to implement and whether, for example, non-state actors may also be integrated into the social protection system. Therefore, at least in my view, the question of funding eligibility should be based exclusively on whether the respective country uses the funds to achieve SDG 1.3, or in other words, for a non-discriminatory social protection floor that is implemented nationwide and for the long term. Whether this actually happens needs to be monitored, of course, but in my opinion, stricter eligibility criteria would not be compatible with the principle of ownership in this particular sector. The second important governance principle is inclusiveness. It has two components, both of which are also briefly addressed in the study. The first is relevant for building partnerships that can really be called equal partnerships. Decisions in the bodies of the financial mechanism must be made on an equal footing between the governments of the contributing states, the donors, on the one hand, and the countries that use the funds to build up their social protection systems, the recipient countries, on the other hand. A necessary precondition for this is that both groups have the same voting rights. There are still fund structures that do not implement this key principle of international development law, but instead favor the donors. However, and I have to make this quite clear, this is a paternalistic, you can also say a neo-colonial approach that no longer reflects a contemporary understanding of global cooperation. And such a one-sided governance structure is particularly not compatible with a feminist development policy, a label that some countries are using for their specific policy approach. In this context, the authors of the study mention as a negative example the global financing facility. They speak of an undue influence that is granted to one side of the stakeholders because the decision-making powers are vested in trust fund investors only following to the World Bank procedures. Such fund structures also exist in the area of social protection, and in my view, there's an urgent need to modify them. The second component of the inclusiveness principle is the participation of civil society. I think the authors of the study have very clearly worked out the different dimensions that are evident here in the existing global funds. Civil society, especially the affected people in the global south, should be given a say and, if possible, even a right to vote in the governing body of the financing instrument. Social security is a human right, so a minimum level of participation is essential not only at the local level, but also in international bodies. And in the special sector of social protection, it is also necessary to involve the social partners, which means the employers and trade union associations. I will only very, very briefly mention accountability, the third governance principle. This is a multidimensional obligation. Transparency and control must be guaranteed both in the relationship between the funding mechanism and the providers of the funds on the one hand, and on the other hand, in the relationship with the governments of the recipient countries. This governance requirement will be crucial mainly for the practical work of a global fund, as it is the only way to establish the trust necessary for a global partnership. These are in brief my comments. I thank you very much for your attention.
Thank you very much, Marcus, for very clear remarks, and thanks also for that slide, which I think captured the three key principles that you've elaborated. I hope that we can pick up on some of the key points, in particular about, that whole principle of country ownership that you talked about, and that inclusive partnership and accountability. I'm sure we will hear more about the role of social partners as we move down to the speakers who will be providing comments. But a key question also comes up in terms of, I'm curious to know of the funds that exist that do have these principles of country ownership and inclusive partnership, like the adaptation fund that was talked about. how do they compare to other funds in terms of attracting the quantity of funding that is needed? I think that's a key issue to look at. I want to now turn to our next discussant, to Geeta, and really pick up again on this whole question of power dynamics and accountability, Geeta, that I know you have been grappling with in your work on international in the public health arena, from a perspective of gender equality and women's human rights. And we heard a lot about the health vertical funds that exist. Now, the question is really quite broad, and I want to know how these human rights and international social security standards can be adhered to in a policy arena that also brings in powerful actors, donors, development banks, private sector entities that are often driven by other kinds of motivations. I think this also speaks to one of the questions that was in the chat box from Deborah Greenfield. So what kind of accountability frameworks have worked in the global public health arena that we can take inspiration from, and what do you see as some of the tensions here that are in many ways inevitable? Over to you.
Thanks very much, Shara. And I'm going to start by sort of setting a little bit of context for what is probably, well, not probably, what is a very broad and a quite complex question. Why do I think that the context is important here? Because we're talking about social protection in 2023. And there are some aspects of context which are deeply affect what we may be able to do by way of social protection. The first one, of course, is that currently austerity policies, an analysis of IMF expenditure projections show that the adjustment shock through austerity policies is expected to impact no less than 143 countries, of which 94 are developing countries in 2023. That is 85% of the world population. That may say to us that we need more money in here, but we also may need to look at whether the intentions of whether the right hand knows what the left hand is doing or vice versa, whether intentions of different actors and players are in fact compatible with each other. The second one is the massive increases in global inequality, which is very much a part of the context where economic inequality intersects with inequality by gender, by ethnicity, disability, and so on. The third one, which of course at the ILO you speak and write a lot about, is the new informality and precariousness that we know about. But there's a couple of elements of it that I think bear particular emphasis. One, this has had drastic effects on women's work and labor force participation. In my own country, in India, we've had a dramatic fall in women's labor force participation rates, not just as a result of the pandemic, predating the pandemic and now continuing beyond that. And it's been made worse in a number of countries by so-called labor reforms that have degraded worker protections, lengthened hours of work, worsened conditions in workplaces. And we're talking about social protection in this context as well. And finally, coming to the health sector. Of course, our biggest contextual challenge here is not just the pandemic, which WHO was greatly relieved to be able to say is over, but everybody knows it's not the only one that we're going to see, and we may see the next one fairly quickly. But in the context of the pandemic, despite much talk of health systems functioning, strengthening, the presence of major global funds such as Gavi, the Vaccine Alliance, there was very high inequality in the availability of and access to diagnostics, to protection equipment for health workers, to vaccines, and to therapeutics for treatment during the pandemic. What is it that a fund for social protection, which includes universal health coverage in its very definition, is going to be able to do that takes us beyond this? There's been much criticism, mainly from civil society, but not only from civil society, of the role of intellectual property rights in privatizing profits at public cost and making it very difficult to get access. Current pressures to retain the same or stronger intellectual property regimes in the pandemic instrument that's currently under negotiation to deal with future pandemics weakens the concerns for equity that are inbuilt in the idea of social protection. Let me step back a moment, and this gets at the heart of your question, Shara. This part of context is that this is part of ongoing and long-standing tensions between the push for primary health care that came out of Alma-Ata through strong health systems focusing on equity, universality, and human rights, versus, and I say this partly with tongue-in-cheek, what has been called the Gates approach. I have nothing against Bill Gates, believe me personally, but it's been called that, an attempt that focuses largely on technology with a dominating role for private for-profit corporations. The question is, where do the vertical health funds fall? What are their pluses and minuses? And what happens to the health system's 6 building blocks that WHO spoke about when we have vertical funds doing this, that slice through the health system in the way that they do? So what's been the experience with the health funds? I think the paper deals with this fairly well. It certainly emphasizes the fact that the 2 big ones, Gavi and the Global Fund, are so large that much, much bigger than EFAT, for instance. And they point to the fact that of the 7 to 8 billion of these 7 funds in 2022, half of that was spent by Gavi and the Global Fund. What are their pluses? They certainly are able to pull together large sums which otherwise may not be available, including, and probably very importantly, from the private sector. Secondly, they've been said by different actors to be more flexible than government health programs. Thirdly, that they're able to focus on critical needs such as child immunization, maternal mortality, HIV/AIDS, and so on. But there have been a bunch of critiques that have been critically important for, and these are long-standing critiques. Weak country ownership, often under duress, a weak meshing with and even subversion of health planning and processes at the country level. The laser focus on a few diseases or target groups has often meant that the root causes which lie in weak health systems stay untouched. Next critique, and this is crucial, they've been much more expensive than they need to be because of weak synergies with the overall system and because of a lot of private profit-driven decisions. And there's been weak learning from mistakes because of weak accountability to people and communities. Now, these criticisms have been in place for quite some time. The question is it fair to levy these criticisms in 2023? How much has changed to address these? Let's look at Gavi, and I'm just going to address a few for each of the 2. For Gavi, I'm going to look at performance, equity, and cost issues. Now, Gavi, as is well known, is a public-private partnership. But in 2016, 50% of all donor assistance in health and almost all of the aid for immunization went through Gavi. That shows you how big it is. But Gavi very much uses what I call tongue-in-cheek the Gates approach, private sector dominated, technology focused. And a Médecins Sans Frontières critique in 2012 said that Gavi tends to focus on costly new vaccines, even though less expensive older ones are available and important. That pharmaceutical companies tend to be overly subsidized through the advanced market commitments that Gavi promotes and poor health system strengthening. I think COVID-19 was a real crucible for Gavi, because this was the moment, and Gavi was a lead partner in the COVAX facility for vaccine access. And I'll just give you one number that can tell you what the challenge was. Gavi promised 2.1 billion vaccine doses in 2021, but actually only was able to deliver 0.9 billion, less than half. And that is serious underperformance by any standard. Also, Gavi promised, as a result of MSF's critique and the critique of others, to allocate significant amounts for health system strengthening. But really, the critique continues to be that it has not delivered much there. If we turn to the Global Fund, and I'm going to look at questions of accountability and ownership, because the Global Fund really tried and has claimed that it's improved accountability and ownership. And I'm just going to quote here from a paper in which I was a co-author in 2021 about accountability and inclusivity, which was based on work done by Barbara McPeak and Anuj Kapilashrami. And the quote is as follows: "Central to the Global Fund's rules were multiple elements that are usually viewed as promoting participation and social as well as performance accountability. But underneath what the authors call this public transcript was a hidden transcript in which real power differentials played out, as a result of which corners were cut on mandated participation rules and mechanisms. All required procedures were accommodated and followed, but a quite different hidden reality of delays in the sharing of information, closed-door negotiations, epitomized the underlying tensions and mocked these claims of participation." So what are the implications of this?
1 more minute, Gita.
Sure. What are the implications of this for what we're trying to do here with the Global Fund for Social Protection? A recognition of the power dynamics in the design and management of such vertical funds is central to their results. And we need to go beyond simply calling for country ownership, because who manages the fund and what their acceptability, as well as whether they have multiple and conflicting intentions. I don't minimize the numbers of children immunized by Gavi or the impacts of the Global Fund on key diseases. The question is, question 1, at what cost? Question 2, is there genuine country ownership, and who administers these funds? And are the administrators all in institutions that are wedded to much more narrow approaches? And 3, are root causes addressed, or are they left untouched and possibly even exacerbated because most of the fund's attention and leadership are too narrowly focused? COVID-19 was the crucible, and I have to say that the health funds didn't do terribly well there. For a social protection floor to work, and this is really my last point, different elements must mesh together, and this group knows this only too well. Only an approach built up from primary healthcare can work, and it's also the only one that can release the energy and inventiveness of communities and people. Thank you.
Yeah, thanks very much, Gita. I think those were very useful lessons in terms of what these health funds have done, which you acknowledge in terms of bringing in maybe more resources, but also several questions about, you know, the efficiency, whether they're really, what kind of ownership, what kind of accountability mechanisms, and the extent to which they really mesh with and strengthen system building in the area of health, of course, rather than creating kind of parallel structures and making this problem of coordination, which the paper also talks about a lot, a serious one. Yeah, so we'll leave it there. I want to now turn to Olivier, who's been listening very patiently. I want to just pose very briefly the question, Olivier, to you about the moment when you first, together with Magdalena Sepulveda, advocated for the Global Fund for Social Protection in 2012. It was, of course, a different moment. And now we have this climate emergency in particular. And some people see this kind of competing with resources for social protection, whereas I think one can make a very strong argument, and there have been in the Q&A chat box, questions about the way in which we need to link them, because for really having climate adaptation and climate mitigation, you need to have a strengthened and universal social protection system. So this is just my entry, but I want to hear from you what you see as the signs of hope and opportunities in this moment, even though we're very cognizant of the context of austerity, the context of rising inequalities and informality that Gita referred to. But still, what are the bright spots, and what are the issues that kind of keep you up at night, that you worry about? Over to you.
Well, thank you very much, Shara, for giving me the floor. I'm conscious of time. I would like to first thank Nicola and Chris for their very interesting paper and the co-authors, of course, and for their presentation this afternoon. I will be as brief as possible because I know we have little time left. I'll make the following 10 brief remarks focused on the paper and in part answering your question, Shara, because when in 2012 we presented this proposal, it was a context not so different as the one we have here. This was just after the global financial crisis of 2008-2009. We had discovered then that people were left without protection despite the job losses that resulted from the crisis and the severe pressure on social protection systems. And the COVID-19 pandemic just reignited that debate in a context that is, of course, not identical, but raises the same question, shows how vulnerable we are. 4 billion people who are unprotected, 53% of the world's population. And my first remark is that for us collectively, the key question should be, why is it that we are not managing to present the establishment of social protection floors as a global public good deserving of more support? What are the political economy obstacles that result in that being underfunded and international solidarity between being insufficient in this regard? Now, in their paper, Nicola and her co-authors identify that gap. At the same time, they remark that a number of funds, such as the Global Financing Facility for Women, Children, and Adolescents, or the Global Fund to Fight AIDS, Tuberculosis, and Malaria, do have some social protection components. But the reality is, this is fragmented for the moment. There's no visibility, there's not enough money going to social protection. And so, although I hear some raise a fear of fragmentation, fragmentation is what we have now without one financing facility that focuses on social protection. We should not fear fragmentation. It is fragmentation that we have now, and that, as a result, makes it very difficult for countries seeking to fund the establishment of social protection floors to seek support and to know where to go, which fund to address themselves to. So that would be my first remark. I think more than ever, there is a need for some new facility to be established to respond to this gap and to establish more coherence instead of the current fragmentation. My second remark is that the proposals for the Global Fund for Social Protection really include two dimensions. One is providing funding as an incentive for countries to invest more in social protection. The other is to provide a reinsurance mechanism for countries to be supported in times of shock, economic shocks, climate-related shocks, for example, in order to allow them to be reassured that if they cannot fund the promises they make to the population, they will receive support. And maybe we need the second dimension to be treated separately. Very often in these discussions, the first dimension takes precedence above the other, yet the other poses specific issues, and I think responds to the needs of small, poorly diversified countries, fearing that if they adopt rights-based social protection floors, they may be taken by surprise, as a sudden increase of the cost of oil may result in them being finance constrained, or a sudden climate disaster striking them, for example. My third remark is that the vocabulary, Global Fund for Social Protection, I think may be misleading. What we really mean is a new financing facility, and that distinction is made at page 29 of the paper. But no one is actually thinking of a new separate organization with a separate legal personality. In fact, in the report I presented in 2021, I'm very explicit that what we need to do is to provide more support to the ILO flagship program on social protection for all. We already have the ILO. We already have the USP 2030 partnership co-chaired by World Bank and ILO. We don't need to reinvent the wheel. And I think we may have made a mistake. I say we, progressive actors working on these issues, in using the terminology Global Fund, because it creates, I think, a wrong impression. And frankly, it is not realistic to believe we'll set up a new Global Fund with a separate legal personality. I think this is a result of the consultations I led in 2020, 2021. My fourth remark is that on page 30, there's a distinction made between global funds that are seen as restitution owed to countries affected, for example, by climate disruptions on the one hand, and donor aid based on charity of donors on the other hand. That's an interesting distinction, but the real difference is between support given to countries on an ad hoc, unpredictable, annual basis, or support that is multi-year, predictable, and therefore allows country to invest in multi-year country programs to establish social protection floors. That's the major difference. I don't care whether donor countries feel they have a duty to provide support or whether they feel it's a good thing for them to provide support. What I do care about is predictability of funding, and that is what the fund should provide. The idea being that countries seeking support should provide multi-year plans to establish social protection floors and increase domestic resource mobilization and be supported in exchange of that commitment. My fifth remark concerns stakeholder participation. I believe the USP 2030 partnership provides the adequate balance of stakeholders, countries from different regions, plus civil society, unions, and so on, and UN agencies and the World Bank. And I do think, again, we don't need to reinvent the wheel. We have there the kind of alliance we need to ensure that the governance will be participatory. That is at least my view, and this would be my response to that question of participation. Remark number 6, lesson number 5 in the paper is that, and I quote, private sources of finance can make substantial new funds available. I'm skeptic. I think the lesson from private donor contributions to the SDGs is that it does not work. I mean, the mobilization possible is not sufficient. So let us not put too many hopes in that, quite apart from all the problems of capture by the private sector this may lead to. My 7th remark, there is in recommendation number 8 a reference to the Global Compact as having to guide in a human rights perspective the support from the private sector. Quite frankly, and with great respect for the authors of the paper, this is based on what the IFAD has been doing since the Global Compact has been established, but the Global Compact has lost much credibility. And today, the good reference is the Guiding Principles on Business and Human Rights. And in any case, that would only be useful if indeed the private sector plays an important role. But I expressed in my earlier remark my skepticism vis-a-vis that hope we put in the private sector providing funding. My 8th remark is that on conditionalities, this has been, in my conversations with governments, the major stumbling block. Governments from the Global South fear, and I understand this fear, that donors will impose their conditions as to how the funds will be used. But note that conditionalities, typically in the history of global development since the 1980s, have been linked to the downsizing of public service, the reduction of funding to health and education, the fiscal sustainability of reforms that would reassure the international financial markets. Conditionalities here are the exact opposite. They are a request that countries being supported work for the benefit of their population. It's conditionalities in reverse. And the major source of funding we can hope for is debt for social protection swaps. We should recall, and you recall this, Shara, at the start of your introductory remarks, that the public debt of developing countries, if we exclude China, is $11.4 trillion US. 45 developing countries put more money in paying back the interest on their debt than they invest in health expenditures. The debt service of developing countries in 2022 was 400 billion. Now, if we have debt for social protection swaps as a major source of funding for financing social protection, that I think is the way to go, but you will not get the creditors agree to giving a blank check to countries. However, the proposals should come from beneficiary countries presenting multi-year plans to establish social protection floors. I think this is the way to go. My 9th remark, the paper suggests, I quote on page 64, a potential UN-wide framework convention on global social protection that, the paper says, may provide an even stronger legal and political foundation from which to springboard a GFSP. I'm sorry, but if we want to kill an idea, the best way to do this is to call for a new international instrument that will be 15 years in the making. We have today the International Covenant on Economic, Social, and Cultural Rights, interpreted by General Comment number 19 of the Committee on Economic, Social, and Cultural Rights, ILO Convention number 102 on Social Security Minimum Standards of 1952, Recommendation 202 on Social Protection Laws. We have Target 1.3 of the SDGs. We have all we need in terms of what countries should do to protect their populations with strengthened social protection. We don't need a new instrument. What we need now is to move towards action. And my 10th and final remark is I welcome this paper as an opportunity to reignite a debate on the Global Fund. But I think our priority should be now to move towards what is realistic, which is to fund much better the actors that are already working on this issue, to connect them with one another. We have all the components of the system. We need it to be more integrated, and we need to make a strong proposal to the Summit for the Future in September 2024, to the World Social Summit in 2025, and to the 4th International Conference on Financing for Development. I've been working on this issue since 10 years. I've seen enough papers. I want now that we act. Thank you.
Thank you very much, Olivier, for that call to action. And I think as well as highlighting and clarifying a number of issues around what you see as the key issues of consolidation, and that this call for a financing facility, as you put it, it's not necessarily a fund, but a financing facility, more resources going to social protection, is really going against this whole trend of fragmentation that we've all been lamenting. and also highlighting the importance of potentially this debt for social protection swaps in the current moment. I think all of that was extremely useful. Thanks also for that reminder of the guiding principle on business and human rights really being where we need to go rather than the global compact if it comes to that issue of accountability of the private sector. Many other points that were highlighted are building on existing institutions, building on USP 2030 as already bringing together the key actors, and the ILO's global flagship program on social protection floors for all. And I have to highlight here also the fact that we do have now the Global Accelerator on Jobs and Social Protection with a financing pillar. That's where resources can go, which already brings together all of the key actors. So a lot there, but as you said, time for action and time for people to, to really put those resources that are badly needed into that system building, which we can all contribute to. I'm very conscious that we have very little time left, but we do have our social partners. I have both Pierre and Alison who are here, and I do want to give them time, but to save on time, I will address the same question to both of them. You were both very active, your institutions, and you yourselves personally, very engaged in the 2021 ILC discussion that really asked the ILO to engage in discussions on concrete proposals for a new international financing mechanism. So what lessons for you are emerging from the experiences of other global funds? And what are the key priorities in your view in moving forward in the way that Olivier just asked us to do, to really move forward and have action? I'm going to start, if I may, first with Pierre, and then I will hand over to Alison. So Pierre, over to you first. And if you could maybe make it 5 minutes so that we can finish by the time. Thank you.
Thank you, Shara, and good afternoon, everyone. Well, it has been useful to get a sense of global fund setting across different sectors. And IOE always push for lesson learned, what works, what does not work, to be taken into consideration before thinking about any direction or decision. A global fund to close specific financing gaps makes sense from the perspective that there are very significant gaps in social protection across many countries. And it is important to mobilize resources and respond to the needs of a wide number of countries where limited capacity compromises the development of sustainable social protection systems. However, we should avoid any new mechanism, new layers, parallel structures. And I think we were, some of us, saying quite the same thing. The establishment of new structures might not necessarily be effective. And also, while ILO has the expertise in social protection and the tripartite convened power, a direct technical cooperation arm in countries, and a broad range of instruments, ILO's past initiative on establishing a global fund did not raise any funds. So we should start by seeking synergy with existing global funds, such as those referred to in the paper, and work towards better coordination with them. Therefore, a careful analysis of existing and past initiative mechanisms, as well as the leveraging of existing, should be conducted. Let me now quickly turn to the research paper. There are issues that need to be carefully navigated in the thinking of a global fund for social protection, if any. And I would like to raise that we do not support all of the proposed recommendations. Let me highlight some of them. First, viability and underfunding. As the research paper also mentioned, there are substantial risks in view of creating a new global fund, notably in terms of underfunding. And one significant risk is that a global fund for social protection might not attract the level of funding that would be necessary for it to make a difference. Furthermore, the report underscores that the World Bank is the current key actor in global funds. So it is regrettable that the World Bank was not interviewed, and we believe that further consultation with the World Bank will be needed. Second, taxation and international initiatives on taxation. There are references in the report to the potential in establishing international initiatives on taxation. Financial transaction tax, public bad taxes, global wealth taxes, they feature prominently in the recommendation. We rather believe that high level of informality in many countries erode the tax base, and prevent the expansion of social protection. So a prerequisite to extending social protection coverage is reducing informality, increasing domestic economic growth, and expanding the tax base. That also happens to be a key part of the solution to the debt crisis facing many of the same countries. So addressing the issue of persisting informality will therefore be key. Third, innovative forms of financing. There is a problematic reference in the reports and recommendation to a commitment from companies to innovative financing models not to violate UNGC principle, UN Global Compact, principles. The UNGC is based on CEO voluntary commitments. So imposing companies a conditionality via mandatory commitments will simply go against the essence of the UN guiding principles Olivier was touching upon just before, and dissuade them from joining the funds. In addition, and I want to say that UNGC does not represent business worldwide, which IOE and employee organization do. We have another concern with the idea of requesting private sector partners to meaningfully promote access to social security for all their employees, including workers in supply chain. Companies are used to doing business responsibly, and social protection is part of the corporate social responsibility. So the problem with the supply chain lies mainly with the domestic supply chain. Most of the time, the states, member states, that should be protecting and guaranteeing this right are lacking. 4, and this is the last point, financial sustainability. We must bear in mind the lack of domestic resource and fiscal space at the national level. Options to increase fiscal space exist, such as expanding social security coverage and contributory revenue, notably through transition from the informal to the formal sector. Some countries have made it possible to mobilize resources and create fiscal space to finance social protection, even in the difficult context of multiple crises. However, there is a growing burden of debt in many countries. So the aspect of sustainability is absent from the analysis and the proposed recommendation. It should be recalled, because it was in your question, Shara, that this aspect was one of the key considerations in the 2021 ILC discussion on social protection. National level institutional development is similarly absent, as well as mechanisms for policy engagement at the national level. The strong pressure on the financial sustainability of social protection systems in many countries called for reform that respond to the socio-economic context. We also need to strengthen coordination between international institutions, though we believe that the ILO should coordinate better with World Bank and IMF for a better assessment of country-specific options to extend fiscal space. And I think we should keep on supporting any relevant areas for research to bring evidence and build a case for improved synergies between social protection and its financing. One area for research could be to assess the use of multiple approaches, and we indeed believe that we should explore all different funding options without any prejudices. It's important to leave all options of financing open. And finally, in conclusion, we should always keep in mind the need to foster an enabling environment for job creation and sustainable enterprises, which will allow to expand the resource allocated to social protection. And I leave it there. Thank you, and sorry for the fast speak. Yeah.
Thank you very much, Pierre, and you did take less time than was originally allocated, so I'm really grateful for that. And thanks also for highlighting some of the key issues around formalization, around expanding the tax base, and also the responsibilities of businesses in terms of their social security contributions. So exactly, that is very much those combination of taxes and social security contribution. That is going to be what a lot of social protection systems, that's what's going to be the real make it or break it for them. International financing, always useful as a complementary measure, but not the real backbone. On that note, I'm going to hand over to our last speaker, Alison Tate. Definitely not least because you have been a very active and vocal champion of the need for this global fund or global financing facility for social protection. Over to you, Alison.
How many minutes do I have, Shara?
Well, I'm afraid due to my bad time management, we have 0 minutes, but I think if you could do it in 5 minutes, that would be incredibly useful. And then we can wrap up.
Okay. I won't be presenting the PowerPoint I had prepared, and I'll try to do it in negative minutes. But indeed, from the union perspective, we see this study as being very important to reinvigorate the discussion that, as we've heard today, has been a substantive discussion on real and realistic feasibility questions to establish a fund or a financing mechanism that takes investment in public policy and in building social protection systems to the next level. After all these years of consultation and deliberation, let's do it. So I'm really clear that from the 2021 ILO discussion, where both trade unions and employer organizations gave a mandate for concrete proposals on the development of a global social protection fund, we now see, and I ask that the ILO take the leadership on doing it. There's a strong mandate. We've heard of all the issues around the failures, the structural gaps of the global financial and development architectures. And we know that coverage is not just a huge challenge in many low-income countries, but the ILO's great research done back in 2020 looking at financing gaps actually showed that low-income countries can finance their own social protection systems once they have had the investment to kickstart those systems establishment. So from domestic resource mobilization, as the language that economists use, we talk about that, whether it be taxation sources or debt swap sources or other forms. We need to seriously look at both the responsibility of the state, of governments, to fund and establish social protection systems, and then really look at this key concept of fostering ownership and coherence, which is what the whole conversation about country ownership, we've moved way on from what is a paternalistic or even colonialist attitude to funding. This is about good development practice with meaningful and effective country ownership, and of the actors within the country, not only the finance ministries or the development ministries or the labor ministries, but indeed social partners, as my colleague from the IOE and I represent at the global level. We need that to be replicated also with commitments and capacities at the national level to ensure that the accountability and the transparency of the design of the systems and the implementation of the systems are done in such a way that it meets the needs of people. Now, we know that with the terrible escalating violence, impacts of the climate crisis, and other economic shocks, the gap is only going to become wider, not less. Olivia has spoken very eloquently just now on some of the practical considerations to take into account around where international organizations can contribute, how we as trade unions and employers and indeed civil society actors can and must and are ready and willing to contribute. So I know that I have no time left and there's much more to say, but I just really reinforce that the financing of a fund at a global level that brings a kind of coherence and is an act of solidarity, as has been said by previous speakers, must be undertaken without delay. So let's get to work on planning and setting it up and implementing it and monitoring its effectiveness with all the skills and knowledge that we all as actors bring to this discussion, and address the social dimensions of all the crises that the people and the planet are dealing with. This is embedded in the work of the ILO, and the USP 2030 structure, as has been mentioned earlier, is a way we can take this up. So Shara, I hand back to the ILO and say thank you for your leadership, and let's take this up with your championship, and let's make it work.
Right. Thank you so much, Alison. I think those should really be the last words. I don't think I have I would like to add much to that, except for I really do have some thanks that I want to please give. And so please be patient for 2 minutes. I do want to say that I think we're very clear that there are serious gaps in social protection coverage and adequacy that need to be addressed. And this call for action and urgency, I think we heard loud and clear. The financing gap for social protection floor, we know, is not being reduced. In fact, we're going to come up with new estimates in January or February of this year, which will actually put numbers behind that. And relative to GDP, we know that it's particularly burdensome for the low-income countries, you know, something like 16% of their GDP to have that social protection floor, additional financing for social protection. We heard that there's great potential in mobilizing international financing. We heard that from some of the existing climate funds in particular, even if there is a real challenge around multiplication of funds, because this poses challenges in terms of coordination and also in terms of duplication, potential duplication. But we also heard that in the area of social protection, we don't have that problem of too many funds and too much fragmentation. And in fact, we do need consolidation. So as well as recognizing that we don't want to have new structures, but really it's important to build on what's already there. We have the USP 2030 as a very effective mechanism that brings together the countries, the agencies, the UN system, the international financial institutions as a very strong sounding board and governance mechanism. And we do have ongoing initiatives like the Global Accelerator and the Global Flagship Program. So we can build on those. Major challenges we heard about governance of global funds in terms of ensuring genuine country ownership and alignment with human rights and international labor standards. Also very important to highlight that really the climate crisis is not something that's competing with the need for funding for universal social protection, but it reinforces the need for building those universal social protection systems as a necessary kind of backbone for countries to have to ensure that everyone is protected and enabled to navigate the major structural transformations that lie ahead and that are already here for many countries, ensuring that those transitions are just, socially and politically sustainable. And really that we need to think very seriously about the real business of building social protection systems, which has to be about strengthening and increasing taxation, social contributions, and doing it in a way that is fair and based on solidarity and burden sharing and does not give undue burden to those with very weak means. So mechanisms of solidarity at the national level, but also more solidarity at the global level, although there's a lot of devil in the detail that has to be sorted out when it comes to those international financing mechanisms. I want to thank all of you, to Nicola and Chris, but also I want to thank their co-authors who've been here, some of whom have been here, Rusa Lambin, Carolyn Snell, Nabila Idris, and Sophie Mackinder, for doing this paper, which I think has reignited the discussion on the need for greater financing for social protection. Let's put it that way. I want to also thank our excellent discussants. I want to thank Marcus, Gita, Olivier, Pierre, and Alison for your very constructive and thought-provoking remarks. We will have a recording of the session so we can listen again and take down those details, and also the discussion that was in the chat. And I want to thank all of you for connecting with us and engaging in this discussion, posing questions. And last but not least, great thanks to our stellar socialprotection.org team for really enabling us to come together and have this webinar. And I wish you all a very good rest of day, evening, afternoon, and thank you very much, and hope we can have ongoing conversation and greater action in this much needed area for creating greater social justice. Thank you and goodbye.
Thank you.